You wake up in the morning, and before your feet even hit the floor, you already know your knees are talking to you. That deep, grinding ache that shows up before you even stand, like your joints spent the whole night rusting while you slept. You swing your legs over the side of the bed, and there it is, that first step, the one that makes you grab the nightstand, because for about 3 seconds, your ankles and your knees feel like they belong to someone 30 years older than you. And maybe you push through it. Maybe you've been pushing through it for years. You take the ibuprofen, you rub on the cream, you do the stretches your physical therapist showed you, and by mid-morning, it loosens up a little. But it never goes away. Not really. It's always there, humming in the background like a low radio you can't turn off. Now, here's what I need you to understand today, and I mean really understand, not just hear. That pain you're feeling, it's not just getting old. I know that's what you've been told. I know that's the easy answer, the one that fits neatly into a 5-minute conversation with a doctor who has 6 more patients waiting. But that ache in your knees, your hips, your fingers, it is not simply cartilage wearing down like brake pads on a car. There is a process happening inside your joints right now that is actively feeding that pain, amplifying it, making it worse month after month, and it's a process that can be interrupted, not with another pill, not with another injection, with something much older than any of that. I've spent years studying communities that seem to defy what we consider normal aging, and one group keeps showing up in the research that fascinates me: the Amish. Specifically, the Old Order Amish communities of Lancaster County, Pennsylvania, and Holmes County, Ohio. These are people who do brutal physical labor well into their 70s and 80s, lifting hay bales, walking miles a day on uneven ground, kneeling in gardens, working forges. And yet the rates of debilitating joint pain in these communities are dramatically lower than in the general American population. When researchers have looked closely, a huge part of the difference comes down to what these families have been putting on their skin, stirring into their food, and brewing in their kitchens for over 300 years. Today, I'm going to walk you through 7 of those remedies, not folk tales. These are preparations that have been used in Amish households for generations, and when modern science finally got around to studying the compounds inside them, the results were remarkable. Some of these you can start using tonight. If you're dealing with joint pain, stiffness, or that horrible morning lockup, stay with me through the entire list because the last 2 are the ones most people have never heard of. Before we go any further, if you find this kind of information useful, I'd really appreciate it if you hit that subscribe button. Also, drop a comment and tell me, which joint gives you the most trouble? Is it your knees, your hips, your hands? I read every single comment, and it helps me know what to cover next. Let's talk about why your joints actually hurt, because if you don't understand the mechanism, none of these remedies will make sense. Inside every joint you have cartilage, that smooth, rubbery tissue that lets bones glide over each other, and synovial fluid, which is the oil that keeps the system lubricated. When everything works correctly, it's one of the most elegant systems in the human body. But here's what goes wrong. As we age, or after injury, or because of chronic low-grade inflammation, the joint lining starts producing inflammatory molecules called cytokines, specifically interleukin-1 beta and tumor necrosis factor alpha. These molecules signal the immune system to send inflammatory cells into the joint, and those cells start degrading the cartilage. Not because it wore out naturally, but because your own immune system is chewing it apart. At the same time, the synovial fluid gets thinner, less padding, more friction, and a constant inflammatory fire burning inside the joint capsule. That's what you feel every morning. It's not rust, it's a fire. Most conventional treatments focus on one piece of this puzzle. Anti-inflammatories block the pain signal, but don't stop the degradation. Cortisone injections suppress inflammation temporarily, but can accelerate cartilage loss over time. What the Amish remedies I'm about to share do is work on multiple points of this cascade simultaneously. They reduce the cytokines, support cartilage regeneration, restore synovial fluid viscosity, and calm the immune response attacking the joint from the inside. The first remedy is apple cider vinegar with the mother, used both internally and as a topical soak. In old order Amish homes, apple cider vinegar has been a staple for at least 200 years. They make it themselves from their own orchards, and they never filter it. That cloudy sediment at the bottom, the mother, is a living colony of acetic acid bacteria. Amish women use it two ways for joint pain: a warm soak, water heated to about 105 degrees Fahrenheit, 1 cup of raw vinegar per gallon, soaking the affected joint for 20 to 30 minutes, and internally, 2 tablespoons in 8 ounces of warm water, sipped with breakfast. Here's why this works. Acetic acid has been shown in research published by the Journal of Medicinal Food to reduce levels of C-reactive protein, a primary marker of systemic inflammation. But there's something else. Apple cider vinegar contains polyphenols, specifically gallic acid and catechin, which inhibit the enzyme cyclooxygenase 2. That's the same enzyme that drugs like celecoxib target. You're getting a mild, natural COX2 inhibitor with every tablespoon. The Amish didn't know the biochemistry. They just knew that when Grandpa drank his vinegar water every morning and soaked his knees at night, he could still work the forge at 78. Start with 1 tablespoon per day and work up to 2. Always dilute it. Never drink it straight because the acid can damage tooth enamel. The second remedy is bone broth, and I don't mean the stuff in a carton at the grocery store. I mean the real thing, the kind Amish women have been simmering on the back of the wood stove for 24 to 48 hours, made from knuckle bones and feet of grass-fed cattle, with a splash of vinegar to draw the minerals out. If you've ever been in an Amish kitchen in winter, you know exactly what I'm talking about. A heavy cast iron pot that never comes off the stove, and the whole house smells like something between a warm hug and a church supper. The broth itself is deep amber, almost the color of dark honey, and when you ladle it into a cup, you can see those small circles of golden fat floating on the surface. That liquid is gold for your joints, and there is now serious science to explain why. When you simmer bones for that length of time, especially the cartilaginous joints and connective tissues, you extract 3 critical compounds: type 2, collagen, the same structural protein that makes up your own joint cartilage; glucosamine and chondroitin sulfate, the building blocks your body uses to repair and maintain cartilage; and gelatin-derived amino acids, specifically glycine and proline, which are essential for synthesizing new connective tissue. A clinical trial published in the International Journal of Medical Sciences found that type 2 collagen supplementation significantly reduced joint pain and improved function in osteoarthritis patients after 90 days. And here's the key. You can buy collagen supplements in a pill, but the absorption and bioavailability of these compounds from a long-simmered whole food broth is substantially higher because they arrive in a matrix with cofactors that help your body actually use them. The Amish preparation is simple. 2 to 3 pounds of beef knuckle bones, enough cold water to cover by 2 inches, 2 tablespoons of apple cider vinegar. Let it sit 30 minutes before heating, then bring to a low simmer for at least 24 hours. When refrigerated, the surface should set into a thick gel. That gel is the collagen. Drink 1 cup per day with a pinch of sea salt. Your joints will feel the difference within 3 to 4 weeks. The third remedy surprised me when I first encountered it in the research. Cayenne pepper salve. In many Amish communities, especially the more traditional settlements, the women make their own salves and liniments for everything from chest colds to sore muscles, and the base of almost every joint pain salve is cayenne pepper. They take dried cayenne, grind it fine, and melt it slowly into lard or tallow with beeswax to create a thick ointment that they rub directly into swollen, aching joints. I've seen Amish women make this in their kitchens, stirring the cayenne into the rendered fat with a wooden spoon, and the whole room smells sharp and warm, like standing too close to a summer garden at noon. The active compound, capsaicin, is one of the most well-studied natural analgesics we have. It binds to a receptor called TRPV1 on the surface of pain-transmitting nerve fibers. When it binds, it initially triggers a burning sensation. That's the heat you feel. But here's what's remarkable. With repeated application, it depletes a neurotransmitter called substance P from those nerve endings. Substance P is literally the molecule that carries the pain signal from your joint to your brain. When you deplete it, the pain signal gets weaker and weaker. A meta-analysis published in the Journal of Clinical Pharmacy and Therapeutics reviewing multiple randomized controlled trials concluded that topical capsaicin significantly reduced pain in osteoarthritis patients compared to placebo, with effects increasing over the first 2 weeks of consistent use. You have to use it consistently twice a day for at least 2 weeks before judging. The first applications will burn. That's normal. Never apply to broken skin. Wash your hands after. Keep it away from your eyes. Look for a capsaicin cream with at least 0.075% concentration. Apply to the joint, rub in thoroughly. Don't wrap it afterward. Pay special attention to the fourth remedy because this one almost nobody talks about. Raw, fermented sauerkraut, not pasteurized. The living, bubbling, tangy sauerkraut the Amish make in enormous crocks every fall. If you've watched a Lancaster County grandmother make sauerkraut, it's almost sacred. She shreds the cabbage thin, salts it by hand, pounds it with a wooden tamper until the juices rise, covers it with a plate and a stone, and lets it ferment in the cellar for weeks. What does sauerkraut have to do with joints? The answer is the gut-joint axis. Your gut microbiome directly influences systemic inflammation. When the gut barrier becomes permeable, bacterial fragments called lipopolysaccharides leak into the bloodstream and trigger body-wide inflammation. One of the first places that shows up is the joints. A 2021 study from University College London found that osteoarthritis patients had significantly altered gut microbiomes. Fermented sauerkraut is one of the most potent sources of Lactobacillus plantarum, a strain shown to strengthen the gut barrier and lower circulating inflammatory cytokines. Eat 2 to 3 tablespoons of raw, unpasteurized sauerkraut daily with a meal. It has to be the refrigerated kind. The canned stuff has been heat-treated and contains 0 live bacteria. And here's a detail the Amish have known intuitively. They always eat sauerkraut with fatty pork. The fat helps the bacteria survive stomach acid and arrive alive in the intestines. When Grandma put sauerkraut on that pork roast, she wasn't just making it taste good, she was building a delivery system. Now the next 2 remedies are the ones I told you about at the beginning, the ones most people have never heard of. The 5th remedy especially works on a mechanism that even many rheumatologists don't routinely discuss with patients, and it comes straight from the Amish beehive. The 5th remedy you can find at any health food store, but the Amish have been using it straight from the hive. It's raw bee pollen, not honey, not propolis. Bee pollen specifically. Amish beekeepers collect it using small traps at the hive entrance. The granules are tiny, golden orange, slightly sweet and chalky. Amish folk healers have long recommended it for stiff joints and weather aches, the kind of pain that flares before a storm. Bee pollen contains quercetin, one of the most powerful natural inhibitors of mast cell degranulation. Mast cells are abundant in the synovial membrane, and when they degranulate, they release histamine and inflammatory mediators that increase swelling and pain. Research has shown that quercetin directly inhibits the production of interleukin-6 in synovial fibroblasts, the exact cells driving joint inflammation. Start very small because some people are allergic. 3 or 4 granules on day 1. If no reaction, double the next day. Increase slowly over 2 weeks to 1 teaspoon daily. Take it with breakfast, mixed into yogurt or oatmeal. Never heat it. If you have a bee sting allergy, do not use bee pollen. Period. For everyone else, 1 teaspoon daily is a reasonable dose, and many people report noticeable improvement in morning stiffness within 3 weeks. If you're still with me, comment the word joints below so I know you're getting value. And if someone in your family still makes any of these old remedies, tell me about it. The 6th remedy takes us back to the Amish root cellar. Raw ginger root, prepared as strong tea and also used as a poultice. When someone complains of joint swelling in a traditional Amish household, the grandmother grates a thumb-sized piece of fresh ginger, steeps it in near boiling water for 15 minutes with the lid on, strains it, and hands it over with a firm instruction to drink it all before it cools. If the swelling is visible, she takes the leftover grated ginger, wraps it in thin cloth, and presses it against the joint for 20 minutes. Ginger contains compounds called gingerols and shogaols, which are structurally similar to capsaicin, but work through a slightly different mechanism. A pivotal study published in Arthritis and Rheumatism compared ginger extract to ibuprofen and placebo in patients with knee osteoarthritis. The ginger group showed statistically significant reductions in pain compared to placebo, and while ibuprofen had a slight edge in pure pain reduction, the ginger group had dramatically fewer gastrointestinal side effects. A more recent systematic review published in Nutrients analyzed 14 clinical trials and concluded that ginger supplementation significantly reduced pain and disability in osteoarthritis patients, with the effect becoming more pronounced after 8 weeks of consistent use. The mechanism is multi-layered, and this is what makes ginger so special. Gingerols inhibit both cyclooxygenase and lipoxygenase pathways, meaning they block two separate branches of the inflammatory cascade simultaneously. This dual inhibition is something that ibuprofen alone doesn't do. Ibuprofen only hits one branch. Additionally, 6-shogaol, which forms when ginger is dried or heated, has been shown to suppress nuclear factor kappa B, which is the master switch that turns on inflammatory gene expression in joint tissue. So you're getting a compound that blocks pain through one pathway, reduces inflammation through a second, and turns off the genetic program that perpetuates the whole cycle through a third, all from a root that costs about $2 at the grocery store. Prepare it like the Amish do. 2 inches of fresh ginger root, unpeeled, grated fine. Pour 8 ounces of just below boiling water over it. Cover the mug with a plate to trap the volatile oils. Steep 15 minutes, strain and drink, twice a day, morning and evening, on an empty stomach. If the taste is too intense, add half a teaspoon of raw honey. Within 2 to 3 weeks, most people notice a measurable reduction in morning stiffness. Now the 7th remedy, and I saved it for last because it gets the most skepticism and yet has some of the most interesting science behind it. A topical application of raw, unprocessed tallow from grass-fed beef kidney fat mixed with dried arnica flowers and camphor. This is the Amish joint rub, and in some communities it's simply called the salve. It's the first thing that comes out of the medicine cabinet when someone's joints are swollen and hot. If you visit a traditional Amish household, you'll find a jar of this yellow, waxy salve sitting on the shelf next to the kerosene lamp, and if you pick it up and open it, you'll smell something earthy and sharp that you won't soon forget. They render kidney sweet slowly over low heat until it's clean white liquid, strain it, and while it's warm, add a handful of dried arnica flowers and a small piece of natural camphor. The salve is thick, slightly yellow, with a medicinal smell you won't forget. Here's why it works. Grass-fed tallow closely matches human skin lipids and penetrates deeply, serving as an ideal carrier. Arnica contains sesquiterpene lactones, primarily helinoline, which inhibit the nuclear factor kappa B pathway. A systematic review in Rheumatology International found topical arnica as effective as topical ibuprofen for hand osteoarthritis. Camphor activates cold-sensing nerve receptors, creating a cooling sensation that competes with the pain signal and increases local blood flow. Render half a pound of grass-fed kidney sweet. While liquid, add 2 tablespoons of dried arnica flowers and 1 teaspoon of food-grade camphor crystals. Let it steep 1 hour off heat. Strain out the flowers, pour into a glass jar. Apply to sore joints twice daily, rubbing firmly for 2 to 3 minutes. Do not use arnica on broken skin or take it internally. I want to tell you about a woman named Doris, 71 years old, lives in rural Ohio, not far from one of the larger Amish settlements. Doris spent 32 years as a postal carrier, walking routes in every kind of weather, climbing porch steps with a heavy bag on her shoulder. By the time she retired at 66, her knees were so bad that her orthopedic surgeon told her she needed bilateral knee replacement. Both knees. She told me she sat in the parking lot of that doctor's office and cried for 20 minutes. She was terrified of the surgery, and frankly, she couldn't afford the recovery time because she was helping raise two grandchildren while their mother worked double shifts. An Amish neighbor named Ruth, a woman Doris had known for years from the farmer's market, started bringing her bone broth in mason jars every few days and showed her how to make the cayenne salve and the tallow arnica rub. Doris was skeptical. She told me she thought Ruth was being kind but naive, but she had nothing to lose. She started drinking a cup of bone broth every morning, took 2 tablespoons of apple cider vinegar and water with lunch, ate a forkful of Ruth's sauerkraut with dinner, and applied the cayenne cream in the morning and the tallow salve at night. She also started drinking ginger tea twice a day. After 6 weeks, she told me her morning lockup had gone from about 45 minutes down to about 15. She could get out of bed and walk to the bathroom without holding the wall. After 4 months, she went back to her orthopedic surgeon for a follow-up. He looked at her, watched her walk, tested her range of motion, and said, "Whatever you're doing, keep doing it. We can postpone the surgery." Doris didn't cure her osteoarthritis. Her cartilage didn't magically regenerate. But the inflammation calmed down, the swelling decreased, the synovial fluid improved, and her functional pain dropped to a level where she could live her life without surgical intervention, at least for now. She still works with her doctor. She still goes to every appointment. But she also makes a pot of bone broth every Sunday and keeps a jar of that yellow salve on her kitchen windowsill, right next to the pictures of her grandchildren. Now, I need to say something important, and I need you to really hear this. If you're taking medications, especially blood thinners like warfarin or heparin, diabetes medications like metformin or insulin, or any prescription your doctor has you on for a specific condition, do not stop or change your medication based on this video. Some of these remedies, particularly ginger and apple cider vinegar, can interact with blood thinning and blood sugar medications. Ginger can enhance the effect of anticoagulants, which means your blood could become too thin. Apple cider vinegar can lower blood sugar and potassium levels, which can be dangerous if you're already on medication that does the same thing. These are powerful compounds, and that's exactly why they work, but it's also why you need your doctor in the loop. Print this list. Bring it to your next appointment. Say, "I'd like to try some of these alongside my current treatment. What do you think?" That's the smart way to do this. You and your doctor working together, that's when the best results happen. Here's what I want you to take away from everything we covered today. Every single one of these 7 remedies works on the same core problem from a different angle. The vinegar reduces systemic inflammatory markers. The bone broth provides the raw materials your body needs to repair cartilage. The cayenne depletes the pain messenger at the nerve ending. The sauerkraut heals the gut lining so fewer inflammatory triggers enter your bloodstream. The bee pollen stabilizes the mast cells in your joint lining. The ginger shuts down 2 inflammatory pathways simultaneously, and the tallow arnica salve delivers anti-inflammatory compounds directly through the skin into the joint capsule. They're not 7 random remedies. They're 7 doors into the same room, and that room is the inflammatory cascade that's been burning inside your joints, and nobody told you there were ways to put it out. Here's what I'd recommend if you're starting from zero. This week, do 3 things. First, make or buy a quality bone broth and start drinking 1 cup every morning. Second, get a bottle of raw, unfiltered apple cider vinegar and take 2 tablespoons in water with your biggest meal. Third, pick up a tube of capsaicin cream from any pharmacy and start applying it to your worst joint twice a day. Just those 3 things. Give it 4 weeks. If you feel a difference, and based on what the research shows, there's a very good chance you will, then start adding the others one at a time. The sauerkraut next, then the ginger tea, then the bee pollen, then the tallow salve. Build the system slowly. Let your body respond. Don't try to do everything at once, because you want to know what's working and what isn't. In my next video, I'm going to cover something that connects directly to everything we talked about today. There's a specific mineral deficiency that affects over 60% of adults over 55, and it directly accelerates joint cartilage breakdown. Most doctors test for it, but almost never at the right level, and the form of the supplement that most people take is the one form that your body can barely absorb. It's going to change the way you think about joint health, and I'll show you the exact form and dose that the research supports. Make sure you're subscribed so you don't miss it. I'll see you there.